Hi guys, welcome to this video. I wanted to do a video following a number of requests for me to take a look at the January 2021 paper. So what I'm going to do today is look at that exam paper as we normally have done in the past, go through the questions, come up with some ideas, some suggestions of how we would approach those answers, and if time permitting, I might even go back through, take a look at the mark scheme and check whether they match up. So as always, I'm going to type my answers onto the right hand side of the screen. We'll have the question paper on the left-hand side, and we'll go through this question by question. I will probably split this paper video into two parts as well. So we'll do part A and B, and then I'll try to do a follow-up video with C and D. So with section A, as always, it begins with ill health. So our case study here is Akram is 22 years old and suffers mental health illness. He's recently been admitted to a psychiatric unit after a sudden decline in his condition. He's responding well to treatment, but him and his family are Muslim. His parents visit every day, and there are concerns that he does not receive care in accordance with his beliefs. So that's the context, that's the scenario, that's what we need to make sure we are referring back to all the way through our discussion of this question. Now, first thing we need to think about is question 1A. And with 1A, it says identify two ways, two is always the key word there, that his parents raise concerns about his care. So how can his parents? So that's one of the big things that with this question, make sure you're reading the question so you know. So his parents want to raise concerns. So if someone wanted to raise concern about healthcare, I would say the main people is they could raise a complaint or concern with the CQC. So that's one way I would say they could raise a complaint or a concern. The second way, they could pull a bit of a Karen, ask to see the manager. Obviously, we're in a psychiatric unit, so it could be they maybe want to speak to the manager of the psychiatric. I'm going to spell psychiatric, copy it from the item because I'm terrible at spelling. Psychiatric unit. There we go. I mean, you could think about other people. They could, obviously, if this is a hospital, an NHS run centre, there will be a complaints procedure. Make a complaint using the settings complaints. I know it only says 2. I've put 3. It's not obviously I'm just putting 3 there, for example. But again, remember that my go-to line. If you're ever unsure, put 1 more. So if you're not 100% about something, stick another one in. Just cover yourself if you're not very confident in what you've said. So 1B moves on with the case study. Take a look at describe the role of one health professional and one social care professional. Now, with this, we need to make sure we are ticking both those. We need a health professional. Move this down so it's a little bit neater on the screen. And we need a social care professional. So in this case, if we're thinking about healthcare professionals, the staple ones you always use, GP, you could put possibly a practice nurse. It could be pharmacist, could be maybe healthcare assistant. No, I'm going to stick with those. So GP, practice nurse, pharmacist, and again, you would explain. So if we stick with GP, a GP would prescribe medication to Akram. I spelled his name wrong. No, I spelled his name right. And carry out health assessments. Boom. There we go. So that's the role of a GP. Social care wise, obviously, people think about social care. We might have a social worker. He might have a support worker. It could be that he would have maybe sort of who else could we have as a support social care team? Maybe off the top of my head, I cannot think of any others, so I'm going to stick with just these two. So I'm going to go with a support worker. would support him with completing day-to-day tasks or activities such as shopping, cleaning, or attending a day centre. Again, I'm sort of having a little bit of a mind blank on terms of support workers, but the idea being we've got our points in both cases, who would we go to, and then we've done a very short explanation as to what they do. So what is their role? So we've got that 1 plus 1. We're going to move on to 1C. Now, this one is more, again, you've got to make sure you're looking at the question. What is the question specifically asking us to do? So this one is about how staff at the unit will be monitored. So again, it's all about the staff monitoring. So we're not talking about Akram being monitored. We're not talking about obviously anything along those lines. This is about how the staff. So the way in which staff will be monitored would be maybe line manager meetings / reviews. So again, their direct line manager will have a discussion with staff monitoring their progress. They will have to engage in regular CPD, continual professional development, to ensure their skills are up to date, and this will be checked via revalidation. So again, as a healthcare worker, you regularly have to revalidate, reapply to maintain your license to practice in care sectors. Monitoring, again, external agencies. CQC will come in and regularly run observations. We might have, again, part of that revalidation, I'm going to come back, is professional bodies. So things like GMC, NMC, our Royal College of Midwives, HCPC, Social Work England, these big regulatory bodies, they may run checks, make sure staff are complying with the codes. So again, I know it's a 6 marker. I generally would say, I always kind of treat these as a 1 plus 1. So you make a point, you explain the point. Within that discussion, you're trying to make sure you're meeting those marks and criteria. So you're applying it to the setting, or you're applying it to the case study. In this instance, we're not applying it to a character, we're just applying it to professionals, I would say, generally. Other ways, finally, I'm just going to shove one more on, is that settings will have a complaints process. So poor professional performance can be raised by patients, leading to investigations. So I would say 3 arguments, 3 points with an explanation would probably be enough for me. That's kind of how I approach these questions. I see them as a 1 plus 1, make 3 points, discuss it, explain it. And again, the explanation with these 6 markers, it's make sure you explain. So it's the how, the why, the what. Make sure that is in there, because that's what the examiners want to see. Just mentioning CQC, as I've done here, wouldn't be enough. They are one of the agencies that monitor, but it's not enough here to actually do anything with that. So settings will have a complaints procedure, that would be fine. Professional bodies may run checks to make sure staff comply with codes of practice. Again, that's a little bit vague. I could have maybe said why. Again, engage in regular CPD. and then I could combine that with a line manager review. So these are the things that are being done to make sure staff are up to date. And lastly, moving down to 1D. Now, this is all about the barriers. This is a common theme. I'm going to put that in here, common theme. The exam board liked to talk about barriers. It's one of those, I did an 8-mark video recently, and one of the things I flagged in there was the common areas where questions come from. Barriers to access care comes up regularly. So do make sure you have looked at the barriers. Now, with barriers to care, there is always the sort of staple ones. So geographical barriers, you've got the transport issues, and also you could combine that with financial. Can I spell financial? There we go. Barriers. So again, lack of income, can't afford the transport, can't get to services. You might have the awareness. So does not know what services and treatments available. And maybe personal, or what they're sometimes called individual barriers. So this could be, again, the idea that, you know, personal feelings, personal preferences. So in this case, we could think about Akram may feel judged due to the stigma of his mental health issues. It could be due to religion. Now, again, we're kind of coming back to the item. The item talks about how there are concerns about whether treatment is in line with his religious beliefs. So religious beliefs and practices may conflict or may clash / cause conflict with some forms of treatment. So this is kind of some of the ways we could think about this. You know, there are communication. Now, again, in this case, it doesn't mention, you know, so it could be ability to speak, it could be language, especially if there's a case of someone with ESL or English as a second or other language. So these would be the key barriers. And this, like, as I say, I put all of the barriers there. But in this case, we don't need to put every single barrier down. What we do need to do is, I would say, is select maybe 4 barriers. So with this case, you might do religion because it's been highlighted in the item. You might choose the personal barrier, individual barriers. You might go with awareness, maybe even a little combination of geographical, transport, financial, and put them in there. The main thing to do, as always with an 8 marker, is discuss the issue, which is part of those mark schemes where they want to show knowledge. So we're talking about what a personal barrier, what a transport barrier, what a religious barrier. You've ticked the knowledge box. Obviously, we want to link to the case. So in this case, we want to link to Akram. So in really, how would this affect him? So we've talked about, you know, personal preferences, individual barriers, may feel judged. That would be the link to him. And obviously, again, just explain it. So this is what we call a skill called analysis. Again, it's from sociology, I would call this analysis. I've spelled analysis wrong. But in this exam board, they talk about lines of reasoning. Generally say. So again, it's the idea you've explained the connection. You've not just said knowledge, Akram doesn't know, and then you've left it. You've got, you know, knowledge barriers is what, you know, people don't know about the treatments. Akram may find it difficult to know what treatments he can take. This means that he may be unable to access services he will be entitled to receive. So it's that idea of making sure you're explaining it. You can throw evaluation in here, so you might want to think, you know, there are advocates that might help overcome communication barriers. There are bursaries or grants or benefits that might help with the geographical, financial barriers. There are patient transport services to help with geographical. So you might want to throw in an evaluative point, almost like the however kind of argument, but again, it doesn't have to be substantial. So that's our first questions, 1A, B, C, and D. So I'm going to move down to section B. I'm going to go with 2A first of all. So let's scroll down and take a look at this question. And then what I'll do is we'll go through these papers and then I'll go through the mark scheme very briefly. And then we'll wrap up this first half and then I'll try and do the second half later today. So the second scenario is learning disability. Now remember, the exam paper follows 4 sections, A, B, C, D. Every section follows a very follows the same patterns. So we have, as we saw with the first one, mental health or ill health. We then see learning disabilities for section B. Let's scroll down to section C, which is all about physical sensory disabilities. And then section D is that kind of slightly one where you're placed in the care sector. So it's obviously age-related needs, but sometimes it's the situation where, oh, there we go, as we see here, you are working in the care home, you are working with the patient. So it's almost, the last section is all about age, but it also changes the format. You need to talk about what you would do as you are the care worker. But coming back to section 2, section B. So 2A, identify 2 social care workers that might work with Jake. Now with Jake, he's 19, he has a moderate learning disability. He currently lives at home with his father. He attends college. He has some challenging behaviour which his dad struggles to cope with, and he needs support with day-to-day tasks. So if we're going with social care, and again, emphasising this is social, not medical or not health. So we might go with a social worker. That's an easy, straightforward one. We could go with support worker. We could, obviously, with his age, we could go with youth worker. We could also go with an advocate, because it mentions, does it mention communication? No, I've had a no, it doesn't. So doesn't have any communication barriers, but maybe learning disability, we could maybe go with an advocate, kind of a little bit of a stretch there. Domiciliary care, maybe, again, it doesn't mention that he has a support worker or a home care worker, but in this case he needs help with most day-to-day tasks, so that could be our idea that he might need a domiciliary care worker. He goes to a day centre, doesn't he? So care manager of day centre. So there's quite a few here. Obviously, I've a couple of others popped into mind from the first question. Could we? I'm just going to scroll. I know I'm kind of jumping all over the place. My brain's got firing. Youth worker. So actually, I mean, Akram being 22, so you know, with that support worker, youth worker would apply. Youth workers generally work with people aged, I've got to remember the ranges now. I think it's I want to say 14 to 25. So in that case, a youth worker should apply. I mean, if anyone wants to correct me on that, throw a comment in the bottom of this video. So we've got a list of workers. Again, we're just listing 2 for this first question. 2B. So the second question now is 2 ways health and social care workers can support staff. So a bit like that first question where it was a health and a social. This one's a little bit broader. You can put health workers, you can put social workers in, but essentially we need to focus on Jake's dad. That's who we need to make sure we're referring to. We don't want to refer to Jake. We want to make sure how they support Jake's dad. So also, again, 2 ways, we're not being asked which social care, so it's kind of just quite general. So we might say that so staff could provide, who's his dad's name? John, isn't it? John, with information or advice on how to support Jake. So that could be one thing, how to support Jake and help his development. They might be that they could arrange or organise respite care. So place Jake in a residential setting for a short period. That could be another way in which they could support John. So with this, again, we're focusing on both cases how John is going to be helped. You know, they might think like almost like the idea that it's bordering on information, but charities, referring to charities that offer support to parents with children who have learning difficulties. Sort of looking towards a charity maybe like MenCap if they offer support to parents as well as people with learning difficulties. So again, I put 3, only need 2, but again, the main thing, focus on his dad. That's what you need to be doing with these kind of questions. So reading the question is always really key. Jumping down to 2C. 2C. So ensure, what can they do at the centre to make sure the service users are safe? So if we're thinking about safety of residents, safety of individuals using the centre, then we've kind of got those staple things we can talk about. So risk assessments, it might be recording, reporting, reviewing, accident policies / accidents, so recording any incidents. There can be stuff like food hygiene / preparation. So again, making sure that any food that's being prepared, served is done so in an appropriate way to avoid infections, illness, injury. It might be obviously stuff like how they keep people safe, so anti-discriminatory promoted. So again, promoting anti-discriminatory practices, encouraging empowerment. Actually, empowerment isn't really about safety, is it? So anti-discriminatory practice. We might have the confidentiality, making sure materials are safe. We can go with COSH, my favourite. I love the control of hazardous substances. So, or control of substances hazardous to health. So again, the idea of making sure, I spelled COSH wrong. So again, chemicals, anything dangerous, you know, whether it's bleach, whether it's washing up liquid, things that could be potentially harmful are put away where they're meant to be. Staff are trained and have appropriate DBS checks. Are trained, / qualified, and have appropriate. So as a 6 marker, we've got a range of things we can say here. And as always, again, this will be our knowledge. This is what we know. We would need to make connections to setting or the context. So these are people working in a day centre, working with vulnerable young people with learning difficulties. So again, it's making sure we're connecting it, that, you know, this is to make sure that there's no discrimination, that they're kept safe. And again, just explaining these points. So again, a lot of this might be how would they do this? How would they make sure they do food hygiene? Why would they maintain confidentiality? How would they comply with COSH? How will they make sure staff are trained? So that's how, again, for these are questions. Pick 3, there's your knowledge. Explain how, why, what, connected to your setting. There's your 6 marks. And lastly, 2D. And then we'll take a look at the mark scheme on this. So how a multidisciplinary team working could support Jake and his father. Now, multidisciplinary teams, another 8 marker the exam board use regularly. They like to use these topics. So again, if we're thinking about a multidisciplinary team, the role, the purpose of a multidisciplinary team, let's scroll this down, is it's multiple agencies working together. That's the key thing. That's what multidisciplinary team is, or multiple professionals. So what we do is, obviously this means discuss how they can support Jake and his father. So one thing we may think about is that obviously this provides holistic care. So multiple groups can provide whole patient care for Jake and his dad. They can also ensure there are no gaps in his care provision. So that's one thing they could do. Holistic care, you've got multiple agencies, it's almost like a puzzle. Each agency provides one piece of the puzzle, they all put it together, it completes the picture of that character. So again, that whole approach and specialist care. They can arrange and organize specialists or equipment or staff. So again, a multiple collection of agencies will hopefully be able to gather the resources, the staff, the equipment. Obviously, however, this does present issues with funding and agencies taking responsibility. So again, with a multidisciplinary team, lots of different agencies, who's going to pay for certain equipment? Is it that they all going to pay a bit? Is one agency going to take the cost? So there could be some conflict there. In terms of how we can support him, again, maybe we can think about information sharing. All agencies share and update information on progress and case of Jake/Dad, ensuring all teams are aware and can update services. So that's the kind of thing we can think about here. And also we're going with one more. Okay, kind of there's information sharing, we've got equipment, we've got holistic care. We could maybe throw in maybe taking into consideration, I kind of already touched on it, Jake's dad as well as Jake in this case. So we might have professionals who can support Jake and other professionals supporting Jake's dad. So professionals who can work specifically with families to support patients. So again, a little bit of a stretch there, but I've come up with 4 generic ideas. Again, in each case, I could probably do a little bit more. They're rough notes. I could probably do a little bit more description, but I've made a point. I've used my knowledge. I've done a very brief description. I've tried to make sure I've connected it to Jake all the way through. I've tried to throw in this little evaluation point. Again, just to show that I'm aware there are potential pitfalls and problems. So that hopefully would tick those boxes. So what we're going to do, we're going to jump right back to the beginning. And we'll quickly look at the mark scheme to check our answers. And we'll kind of tick these off as we go. So just going to scroll through here. There we go. So the first one, which was about raising a complaint. So who could we raise a complaint with? We've got hospital complaints procedure. We had that. And we discussed with unit manager. Yeah, there we go. So I noticed I said about the Karen process, speak to the manager. But obviously we've said psychiatry. They've said unit manager. I said psychiatry unit. Absolutely fine. Oh, advocacy. Contact CQC. I think we did mention as a. Oh, there we go. Raise a concern or complaint with the CQC. That was one other that we threw in there. Advocacy. I suppose you could speak to an advocate if you had one. Raise with PALS. So yeah. So another patient sort of awareness group. PALS. That would be fine. We're looking for B. It was the health worker and the social care. So we had health worker. We said GP. Which we've covered, yep, so that's fine. And again, who else do they accept? So we've got pharmacist, we tick that off. Oh, occupational therapist, practice nurse, community psychiatric nurse. So there's actually quite a few people you could select there. And again, in each case, what do they do? What is their job? And then support worker, sorry, social care staff. We went with social worker, support worker. They were the only two I could think of. Obviously, youth worker obviously popped into mind recently, which would also apply here. So social worker, to provide emotional support, advocate, provide information. And we went with support worker, support day-to-day activities, which we have. Perfect. What I always love about these questions, accept any other valid response. That's always my favorite part of the year 2 exam. As long as what you said is realistic, practical, or linked, you should receive credit for it. 1C is that next one. So staff monitoring, we said line managers, we had staff development revalidation, we had external inspections, yep, we mentioned CQC, or whistleblowing. We didn't have whistleblowing, but that's one way you could raise a concern. We had complaints procedure, but I suppose you could extend that to whistleblowing complaints. Professional bodies, regulation and monitoring. We did mention they run checks, so we're kind of on that right line. Service user feedback, which is kind of on the complaints process, and criminal investigations. Okay, so we didn't have any criminal investigations, but again, we've got the what, we just need to say the how, the why, the who, to just add a little bit of detail to that. And 1D, barriers. Again, another common theme, as I mentioned. So what we got barrier-wise. Specific needs, we kind of went personal choice, didn't we? Individual personal needs. I remember writing that one. Well, individual preferences are separate ones as well. Financial, geographical. They got transport on there? No, it must be kind of incorporated into geographical, financial. Social support. Oh, social we didn't have. So family and friends being supportive or maybe not being supportive. Religion we had. Lack of understanding. We had awareness barrier. Communication barrier. We mentioned that one. Psychological and emotional. So we didn't have that. But as I say, there's a lot of barriers here. If you picked 4, explain what the barrier is, how it applies to ACRAM, what that does in terms of its care, and if there's any way to overcome said barrier, like the patient transport group, benefits, bursaries, providing advocates, then again, that's what we're looking for. So we're all good here. We're kind of on track. 2A, it was again 2 social support staff. Social worker, we mentioned, support workers on the list, youth workers on the list, advocate, domiciliary care we had, care manager. Who have we missed? Care assistant. Oh, okay, so care assistant was the only one we did. Obviously, this question is quite specific. Don't accept health workers. We said not health in our answer, but anything else is fine. We've then got 2B. It's all about Jake's dad here. There's quite a lot of suggestions. So refer to charities. We mentioned charities might be able to offer help. Involve in the care planning. Okay, I hadn't considered that one. So make John part of the care plan. Arrange respite care, we mentioned. Arrange carers assessments to make sure John's support needs are included. We hadn't had that one. Act as an advocate for John. So we're going to advocate for John and an advocate for Jake. Provide daily personal care for Jake to allow John to keep working. Oh, I hadn't considered that one. Make sure, okay, and again, make sure they're referring to how John is going to be supported here. And lastly, nearly lastly, 2C. So this is how we keep people at the centre safe. So I think we've got most of these. We kind of count, risk assessments, recording, reporting. We didn't mention policy, following policies, but kind of it's in part of that reporting. Anti-discriminatory practice. Oh, empowerment would be considered. So empowerment, promote individualized care, I guess. I was thinking empowerment is encouraging independence and, but yeah, safety, I guess, would come into that if you individualize your specific care. Maintain confidentiality. Effective communication, I suppose, could be one. Refer to care value base. Only carry out tasks trained for. Follow infection control. So again, I didn't have infection control. I had food hygiene. Not on the list, but I would still say would be appropriate. And last but not least, 2D. So this is the agencies working together. So we can see there's quite a few, not a very long list, but it looks like improved information sharing, joined up work, holistic care, empowering Jake and his father. I don't think I mentioned empowerment. offer specialist support, his needs of his father are considered, and ongoing reviews take place. Okay, there we go. So actually, looking at this so far, we're kind of pretty much on track. As always, these are kind of very brief notes. They're not a full written answer. I'm going to leave that for you guys. I can't give you all the answers to these questions. So again, you could work on this. You can develop this and write these up yourself. As I say, I know a lot of you have been asking for this. I will try and do the second half of this paper today and get that posted either tonight or the next day after this video goes live. So I will work on this. As always, thanks for watching. Hope this is always helpful. Please like, subscribe, all those good things that are helpful for me on YouTube. And again, tell your friends. Make sure they, if you've got friends doing health and social care, they're struggling, they're finding stuff difficult. I've got loads of stuff on my channel that might be of use. Even if it's just one video, makes a bit of a difference. Hopefully that will help them. So thanks for watching.